months until local authorities have to get applications in. But of course, because of where Waterford is with this project, it's well ahead of the rest in terms of being able to secure additional funding. Thank you.
Mary Butler, please.
My question is directed to the Minister for Health. Minister, if I could return to the health support strike planned for tomorrow. I wanted to take it from a different angle. I'm just wondering what contingencies have been put in place in the event of the strike going ahead. We hear about the fantastic work these health workers carry out on a daily basis. I suppose they are the cogs that turn the wheels in the HSE day in, day out. And understandably, elective surgeries will be cancelled tomorrow. But I want to ask in relation to the inpatients in the hospitals, especially the older and more vulnerable patients who depend on these services in relation to the basics, such as even feeding themselves. Will the families be contacted to step into the breach in the short term? If you could just let us know what contingencies you have put in place in the event the strike goes ahead tomorrow.
Deputy Mitchell, are you offering on the same? No, it's a different matter. Okay. Sorry, Deputy Peter Fitzpatrick, on the same matter.
On the same issue, Taoiseach, it's important that the government honours its commitment. 10,000 support health are planning to go on strike tomorrow across 38 hospitals, including the Light County Hospital in Dog and also the Our Lady Luth Hospital in Drogheda. This government has made a commitment, and this comes under the framework of the public sector. Listen, Taoiseach, these people don't want to go on strike, but these people were promised back as far as 2016, 2017 and 2018. All I'm listening to at the moment is on the airways that Taoiseach said go to the labour courts and this and the other. Taoiseach, we have sick people who have been waiting years, months and everything else on waiting lists. This is something that can be done with a stroke of a pen. And all I'm just going to say is, Taoiseach, yourself and the Minister for Health, can we not just either get something done today, stop this strike, because the last thing we want to do is to affect vulnerable people.
Thank you, Deputy Minister.
And Deputy Fitzpatrick for their question in this regard. Obviously, my colleague, the Minister for Finance, has dealt with the issue from an industrial relations mechanism, and I hope progress can be made on that today. From a contingency planning point of view, which I think is at the core of the Deputy's questions, the HSE and SIP2 at a local level are putting contingency plans in place. It's important to say that this varies very much from hospital to hospital and site to site, depending on the local arrangements and the staffing arrangements of those hospitals. The HSE has indicated that if the industrial action goes ahead, which I hope it doesn't, and believe it can be averted, if it does go ahead, it will result in some elective procedures being cancelled, mainly in the area of scopes. But the priority today, whilst contingency planning is going on,